The American beauty industry is great at creating problems to market to. Small details, barely noticeable in the grand scheme, suddenly become fixable problems. Are your nail beds not fabulous enough? Paint them. Are your eyelashes embarrassingly short? Put this goop on them. Are your teeth yellow? Put this bleach strip on them. But is this beauty trend all smiles? In this project, I will investigate the pros and cons to teeth whitening products. Although tooth color seems something almost arbitrary when you think about it, the beauty industry has succeeded in making $1 million mountain out of this molehill. I mean, if you believe what they want you to believe, it's the white teeth people that get the job, get the guy, and get the happy ending, you know? Well, actually, according to the American Academy of Cosmetic Dentistry, 97% of people believe that a smile is an important social asset. That's fair enough, right? You know, smile is the first impression. But 74% of people believe that an ugly smile, or just an unattractive yellow smile, can actually hurt one's career success. 74% of people. I mean, with those statistics, maybe it's not so crazy to think that you would want your teeth a few shades lighter. So, although there are natural ways to keep your teeth white, strawberries make them white. Studies have shown that baking soda helps keep them white. And also avoiding coffee and tea keeps them white. But, you know, people in this world like coffee and tea. And we want to drink our coffee and tea, but we don't want to have yellow teeth. So, the solution is whitening strips. It can come in the form of at-home, over-the-counter whitening strips, in-office treatment, supervised by the dentist, or out-of-office treatment supervised by the dentist, which is like a whitening tray specifically fitted to an individual's teeth. So, according to OxyFresh Worldwide and the American Dental Association, the only two ingredients allowed to be used in American dental whitening are hydrogen peroxide and carbamide peroxide. And carbamide peroxide is the more mild of the two, and it's actually just a lower concentration of hydrogen peroxide itself. Okay, so to give you an idea of the strengths of the different products available, at-home whitening strips, like over-the-counter things that you can buy at CVS or Walgreens, contain about 10% hydrogen peroxide. Then if you go to the dentist and get fitted for a tray, they are able to give you up to 16% hydrogen peroxide and 10% additional carbamide peroxide with that. And then if you go to the dentist and get your teeth whitened in the chair, like you make an appointment, you set that up, they are cleared to use up to 40% concentration of hydrogen peroxide and an additional 35% carbamide peroxide. Sounds like a lot. I know that sounds kind of crazy with all those chemicals. You know, the mouth is a very sensitive area. It's almost like, why would you wouldn't want to put chemicals in your eyes or like up your nose. It's sort of the same thing. Don't put them in your mouth. And you know, it's not like there aren't side effects either. Let me just give you an idea. White teeth, it's what everyone wants to see. Ask your dentist, ask your mother, ask your neighbor if white teeth are right for you. The answer will be yes. Side effects of teeth whitening may include soft tissue irritation, hypersensitivity, burning sensations, tissue damage, gum irritation, throat irritation, uneven or spotty whitening. Do not operate heavy machinery when whitening teeth. Whiter smiles, it's what people want. Ooh, okay, yeah, that sounds bad, but according to Dr. Leonard's study in 1998, as cited by Animated Teeth, side effects for most patients were a non-issue. Like, as in, they were negligible. Just put on the package to be very safe and inform the consumer of everything that might possibly happen. And in his study, in Dr. Leonard's study, he asked the participants to rate any discomfort they'd experienced while whitening on a scale of 1 to 10, and the majority of participants rated it a 1 or a 2. Even the American Dental Association admits that there are very, very few risks for any severe or adverse effects in monitored at-home whitening, dentist-administered whitening, or FDA-regulated whitening. The implication in this is that the really severe cases of side effects are coming from the sketchy mall kiosks, the unregulated spa whitening treatments, and dollar store bleach strips, just all the unregulated parts of the industry. If you stick with the dentist and you stick with the instructions, you should be safe. but you know, it wouldn't hurt to weigh it out. We can do a pro-con list. Most side effects, like translucent looking teeth or throat irritation, can be completely avoided by dentist supervision and just following the instructions. Those are side effects that happen when you overuse the whitening strips. And if you look at the instructions, there are definitely clear guidelines of how often you should and can whiten. Effects like burning sensations or throat irritation can be avoided by a simple check-in with the dentist. That's just a matter of how sensitive the individual's teeth are. And after meeting with the dentist, he is able, according to the American Dental Association, he is able to check for exposed roots, broken enamel, things that would cause sensitivity, and then adjust the concentration of carbamide peroxide and hydrogen peroxide in the treatment accordingly. That way the sensitivity and the burning sensations can be completely avoided. And then the pros are, of course, a more radiant and white smile. And with the mass marketing done by the beauty industry, that radiant and white smile is going to be the key to many doors in your career. It's going to be, the pros of a whiter smile include just more beneficial social interactions and greater job success. Buying into whiteners are almost like buying into your career if the statistics I cited earlier are to be believed. So here's the thing. As long as white strips are used in moderation and under the instruction of a dentist or the FDA, the consumer should be able to indulge their vanity without sacrificing any of their oral health. That's nothing, that's nothing. But according to Dr. Leonardo's study in 1998, yeah, I know, it sounds, yeah. Yeah. Even the American Dental Association admits that okay. Yeah, I know, it sounds crazy with all this coming. Side effects for most patients were negligible. In-home whitening treatments, apparently, I don't know, this is what my mom says. But according to Dr. Leonard's study in even that,